Hi, I'm Dr. Ilavarasi, Consultant Medical Gastroenterologist, Chennai. Now, every year, November is GERD Awareness Week. So, what is this GERD? GERD is nothing but Gastroesophageal Reflux Disease. So, as the name suggests, what happens here is the stomach acid, which has to stay in the stomach, keeps refluxing back into the food pipe, that is the esophagus. So this esophagus is a very sensitive region. So this on repeated acid exposure gets inflamed and causes all serious complications when left untreated. Now what are the common symptoms of GERD? So as we all know, heartburn and regurgitation. So these are the two common symptoms of gastroesophageal reflux disease. So can they present with other symptoms? Definitely yes. There are some atypical symptoms for GERD. They are chronic cough, wheezing. They can present with change in voice or hoarseness of voice. They can present with dental erosions. They may be under treatment with a dentist, or sometimes for wheezing and cough, they might be under treatment with a lung specialist, but the lungs will be absolutely normal. And similarly, they can also present with chest pain. So they might be rushing to the emergency and taking repeated ECGs and it might be normal. So these are some of the atypical manifestations of GERD. Now, what are the risk factors for GERD? Who is at risk of developing this condition? Number one, unhealthy lifestyle, eating at irregular time, not following a right healthy lifestyle like chronic smoking, chronic alcohol intake, presence of a hiatus hernia, which is nothing but a portion of the stomach tissue gets into the chest cavity through the opening called diaphragm. So this is one of the common risk factor for GERD, which can be identified by imaging or an endoscopy. Now, pregnancy is again a risk factor for a new onset gastroesophageal reflux disease, or the pre-existing GERD can get worsened. Some connective tissue diseases like scleroderma, SLE, all these are risk factors for GERD. So some medications can also predispose to GERD. What happens if you leave GERD untreated? Definitely it results in complications. Repeated acid exposure to the food pipe, that is the esophagus, makes the esophagus inflamed and leads on to a condition called esophagitis. Now this esophagitis, when it keeps progressing over, leads on to a precancerous condition called Barrett's esophagus. Now, this Barrett's esophagus, when not treated, leads on to esophageal cancer. It can also lead on to esophageal stricture, that is, the food pipe gets narrowed because of chronic acid reflux. And it can also lead on to serious complication like blood vomiting and black stool, which we call it as hematemesis and melena. So, what is the treatment for GERD? Once you are diagnosed with GERD, what are we supposed to do? Please remember, healthy eating and physical activity plays a major role in management of gastroesophageal reflux disease. Then comes your medications. So, combination of all three, healthy lifestyle, physical activity and medications, are the treatment for gastroesophageal reflux disease.